Is there a formula for perfect patient care? Today, we're exploring how nursing capacity is calculated and managed. In healthcare, there's one critical question every hospital faces daily. How many nurses are needed to provide safe, quality care? This question isn't just about filling shifts, it's about balancing patient needs, hospital resources, and nurse well-being. Understanding nursing capacity measurement is key to efficient and safe care. In this video, we'll explore the core methods hospitals use to assess nursing workload and capacity, from data-driven models to real-time decision tools. Let's start by looking at why these measurements are vital. Patient acuity models assess each patient's care needs. Nurses input patient information like diagnosis, mobility needs, and risk factors into a system. The model assigns a score to each patient based on the intensity of care they require, which helps determine staffing needs. Nursing hours per patient day, or NHPPD, is one of the most straightforward methods used to determine staffing needs. Here's how it works in detail. NHPPD is calculated by taking the total nursing hours available within a 24-hour period and dividing it by the number of patients during that same period. For example, if there are 50 nursing hours available and 10 patients on a unit, the NHPPD would be 5. This means each patient, on average, receives 5 hours of nursing care within that day. NHPPD is popular because it's a relatively simple measure to calculate and provides a quick overview of staffing needs. It's especially useful in consistent, routine settings where patient needs don't vary drastically day to day, such as in long-term care facilities. However, NHPPD has limitations. It doesn't account for the varying complexity of patient cases. For instance, a unit with critically ill patients will require more intensive care, but NHPPD doesn't differentiate between a patient requiring minimal care and one needing round-the-clock monitoring. It also doesn't adapt well to unexpected changes like patient surges, which can leave nurses stretched thin. Despite these challenges, NHPPD remains a foundational metric. Hospitals often use it in combination with other methods to get a clearer picture of staffing needs, ensuring it's not the sole measure for determining nursing capacity. In today's fast-paced healthcare environment, predictive analytics and real-time data are transforming how nursing capacity is managed. Predictive analytics involves analyzing historical data like seasonal patient admission trends or staffing patterns. By identifying patterns, the system can forecast patient demand and nurse availability. For example, if past data shows a consistent spike in patient admissions on weekends, the analytics system might predict a similar trend, allowing hospital managers to proactively adjust staffing levels. Beyond predictions, real-time data provides a snapshot of current conditions in the hospital. Electronic health records, or EHRs, feed real-time data into systems, showing factors like patient admissions, discharges, and even emergency room intake. This allows hospital managers to make immediate staffing adjustments based on current patient load, which can be especially valuable during emergencies or unexpected patient surges. FHIR, or Fast Healthcare Interoperability Resources, is a standard designed to improve the sharing of healthcare information between systems. FHIR makes real-time data sharing possible by enabling different software systems such as EHRs, staffing platforms, and analytics tools to speak the same language. When EHR systems use FHIR standards, they can easily push updated patient data across hospital management platforms, facilitating immediate access to critical information for decision makers. For example, if real-time data shows a high number of admissions and FHIR-supported EHRs confirm multiple high acuity cases, the system can alert nurse managers to bring in additional staff or redistribute workload. This responsiveness prevents burnout, ensures that patients receive timely care, and helps maintain a safer environment for both patients and staff. An often overlooked aspect of nursing workload management is the metadata behind it, the structured information that describes and categorizes workload data. Metadata in this context includes details like nurse-to-patient ratios, care intensity per patient, and staff shift patterns. Having standardized metadata can significantly improve how workload is measured, analyzed, and managed. A nursing workload management metadata set would be a standardized collection of essential data points that capture nursing activities, patient care needs, and workload distribution. This dataset could include variables like time spent per task, patient dependency levels, and environmental factors that affect workload. By standardizing these metrics, healthcare organizations can ensure that workload data is consistently collected and accurately reflects the realities of nursing care. Standardizing metadata means that data collected across departments or even between hospitals can be compared, analyzed, and used more effectively. Without standardization, workload data may vary in format and meaning, making it challenging to draw accurate comparisons or create effective predictive models. A standardized metadata set ensures that everyone, from nursing managers to data analysts, works from the same understanding, leading to better insights and decision-making. Many nurses in the healthcare field recognize the need for such a metadata set, arguing that it would bring much-needed consistency and accuracy to workload management. By adopting a standardized nursing workload management metadata set, healthcare systems could not only improve patient outcomes but also enhance job satisfaction for nursing staff by addressing workload challenges more systematically. International EHR metadata standards such as ISO 13606 Part 1 and Part 2 HL7 CDA2 or HL7 Fast Health Information Resources or HIR need to be considered when creating a metadata standard. Healthcare professionals wonder why it is that their electronic medical record or EMR systems create more work, not less, but still don't talk to each other or to other products. Why there has not been more progress on computing with health data for disease prevention. Why there isn't a reliable shared medications list. And why they still have to use non-computable guidelines and protocols instead of having IT tool support, such as we use when navigating in our cars. OpenEHR has a goal to fundamentally change the quality of information technology in the service of medicine so as to improve outcomes in clinical healthcare, public health, and the value of secondary data use. As we've seen, measuring nursing capacity and workload is essential for safe and efficient healthcare delivery. Each method, from NHPPD and patient acuity models to real-time data and predictive analytics, plays a unique role in creating responsive, data-driven staffing strategies. These tools enable hospitals to adapt swiftly to changing patient needs, reduce nurse burnout, and ultimately improve patient outcomes. With standardized data sets, real-time EHR integration through FHIR and predictive analytics, hospitals are better positioned to create a work environment where nursing staff feel supported and patients receive timely care. Looking forward, the call for a standardized nursing workload management metadata set reflects the ongoing shift toward a data-driven healthcare system. With growing support for metadata standardization and real-time data utilization, the future of nursing workload management holds promise for more equitable and effective staffing. These advancements could transform healthcare environments, making them not only more efficient but also safer for both nurses and patients. By embracing these tools and standards, we're not just optimizing shifts, we're enhancing the very foundation of patient care.